Welcome back to another video. Today, it's my goal to show you what a typical day looks like in the life of an internal medicine resident on ambulatory rotation. So I do my basic morning routine, and of course, I do take a shower before leaving home. Wondering how many of you like to shower at night and then dress up and leave in the morning? Well, I know I'm not part of that team.
I can, I will, I must. I'm a child of the King of Kings and of all.
I say my positive affirmations based on my faith and belief with a confidence that it shall be as I have spoken. And I do this on a daily basis to get my mind ready.
Courage and mercy to Allah, favor and smile, wisdom, inheritance, knowledge and understanding. As these men until I'm true.
Yep, this is the day. So I head out as quietly as possible because I don't want to wake the kids up. So that's the lobby. And there's a mirror here that I call the swag check mirror. Ooh, yep, that's a drip for the day. I get in my car and the 45-minute drive begins. So in my residency program, we usually have a meeting at 7 a.m. called Morning Report, where the first year resident presents an interesting case or a complicated case, and we milk out the diagnosis based on the information given. They go further by teaching us a little more on the disease process of the final diagnosis. So after morning report, each resident can go about their respective duties. Due to COVID, morning report has been suspended, leaving more time in the morning. So right now, I'm heading to the hospital to get breakfast and then drive to the clinic afterwards. Ideally, on my drive, I do my devotion using Bible in 1 year with Mickey Gumbel. I also listen to online med-ed. Sometimes I watch YouTube videos from ICU Advantage. I think it's by Eddie Watson. I consider checking him out. Other times I do nothing. I just drive and get deep into my thoughts. Your boy got a sandwich, banana, some strawberries hiding behind the Gatorade. I usually keep the Gatorade for later. So I'm walking back to the car to head back to the clinic. The first patient usually arrives at 8:30. So I do my very best to arrive before the patient does. And that's me walking in. And you know, it's another day to put a smile on someone's face. So when I get in, I find a room that would not be used by a patient for that day. To ease through the morning, sometimes we chit-chat a little bit and see how the weekend went or the day prior went. It's always a good thing to connect with your nurses. You know, they teach us a lot in residency. So I salute all nurses. Thank you for the sacrifices and what you keep doing for the medical team and for patients. We are required to use this mask. I think it's a level 3 mask. Just fact check me on that. Which usually has an attached face shield. So I take off my surgical mask and I put that one on before I see any patient. So I log in, see which patient has arrived, and get ready. On ambulatory rotation, everything is structured so you know who is coming in and for what reason, so you can prep ahead. Efficiency is key. So after setting everything up, we wait for the big shot to show up. This is no other person than Dr. Turro, who is also my mentor. Patients always have words of praise from him. He is valuable to us, they say. He's the reason my mom is still alive. You know, he came to visit me when I was sick in the hospital, even though I did not even call him. He has made this county better by caring for the less privileged. Consider working for him when you graduate. So these are the stuff I hear patients tell me when I'm in the room with them. Anyways, this week I'm rotating with my classmate, Dr. Keating, and one of the interns, Dr.Marin. Yep, that's him. That's Dr.Turro. So we get debriefed, and patients are distributed amongst us based on whether we saw the patient in the past or at the discretion of Dr.Turro himself. So I come back and quickly review the first patient assigned to me. In a clinic or interns, you see patients 18 years and older. You know, it's always been my dream to become a doctor since I was a kid. So I am happy where I am in life currently. I've been a cashier at a retail store, been part of the freight team, restocking goods, inventory team, dietary aid at a nursing home, washing cooking pots like no other. I've also been an EMT, Uber driver as a side hustle, and others. But my end point of becoming a doctor has never changed. I use this as an encouragement to anyone with a dream of becoming someone valuable one day. Yes, you can. Stay focused and keep pursuing. One day you will look back and see how far you've come. Most importantly, don't forget to mentor others when you reach that end point. In my world, you are a failure if you reach success and can show others how you attained it. Don't leave this world without passing on the baton. So I went to see the first patient, presented to Dr.Turro in the room with the patient, and he rendered the teaching points. Others were entered into the chart, and I came back to the base to type my note. That's Dr.Marin putting in work. Yeah, she's my mentee with a future brighter than you can imagine because she has potential. I like to open tabs in Google Chrome like Dynamed, UpToDate, Mixapp. This will be me looking up some disease processes or some information, and also learning from the case right there. Sometimes I find questions and I bookmark them for later. We have the luxury as resident and mostly see between 4 to 7 patients a day, depending on how many residents are in the clinic or are on that rotation. Common cases that we see include joint pain, headache, upper respiratory symptoms, earache, people coming in for medication refills, annual physical, and others. Aside from getting annual physicals done, we also need to make sure patients are up to date with your screenings, immunizations. We screen for depression. For our elderly patients, we revisit their goals of care as to what quality of life they aspire for. I left a link in the description box to the recommended screening guideline for those interested. And usually this is for those in the United States, because I know other countries have their own guidelines. Continuity of care is key in the clinic. We do form a professional relationship with our patients, and they do trust us with their personal information. As you can see, Dr. Keating getting ready to type up his patient note. So while typing a note, or mostly when I'm done typing it, the nurse comes in telling me about my next patient. They usually give us the chief complaint, vital signs, and we go from there. Just like it was in USMLE Step 2 CS. Ooh. Today's lunch was on the house, sweet potato fries and buffalo chicken wrap. Oh, looking good. I had to air fry those fries to make them extra crispy. I don't usually do fries, but when I do, I like them crispy. I think I need to check my cholesterol levels soon. Anyways, after lunch, the process repeats. Aside from that, we also call patients with the results of the blood work performed on their visit. So like I said previously, documentation is key. So we write a little note in the chart. No documentation means it never happened. So the day ends after the last patient is seen. To limit exposure, Dr.Turro likes to see suspected COVID patients or those coming in for testing in their cars by himself. Of course, in the provided PPE. So the day is over. Typically by 4 p.m., the day is done. It feels great to get out of work with the sun out. This usually doesn't happen on rotations like ICU or being on the medical wards. So I get home, shower, sometimes I get to hit the gym, and then I shower. And it's all based on the help my wife needs when I get home. And I do find time for the kids and prep for the next day. So please get your appointments and see your primary care doctor and stay up to date on your screening and immunizations. Eat right, exercise if you can, wear your mask, and consider getting the COVID vaccine and booster when available to you. Until then, stay positive, be encouraged, you can do it. I'll see you in my next video. Shalom.